right, so I'm going to start with my faculty huddle before I seat my patient. Miss Leo flag and ready.
Okay. So what do you?
So I screened my patient on November 6th, about 3 weeks ago. Dr. Sheikh signed the radiographic determination form. This patient has type 2 diabetes and high blood pressure. So during my screening, I filled out the medication information form. This is the new one that I did today. So if nothing's changed, this will be the one that I use, or if there is any changes to the medications in the past 3 weeks, I will add them.
Okay.
Or cross them out as needed.
Yes.
Here you go. I have my process form for you. And I also already filled out my pink slip. It's ready to go ahead of time.
All right, just make sure you fill out this section right here, how many images, and then if they have a dental appointment.
Oh, okay. So yeah, I put his dentist already there. Oh yes, I forgot. He has an appointment on December 2nd, so I will write that on here. So we notice on that by. Can I get my patient?
Yes.
Okay, I'm ready to go.
Yes.
All right. Hello, Mr. Dexter. Nice to see you. Come on in today. Feel free. You can have a seat here. Thank you for coming in today. So I know we went through your full medical history a few weeks ago. This will be a little shorter. So just a few quick things. Has there been any changes to your medical history since the last visit on November 6th? No? Excellent. Glad to hear it. Have you had to see your physician since your last visit? No? Okay, excellent. Have you been hospitalized since your last visit? Nope. Awesome. And last time I see you take metformin 50 milligrams a day and lisinopril 10 milligrams a day, once a day. Is that still the same? Do you take any more or no longer take any of those? Great, still the same. Love it. Easy peasy. No changes are good changes, right? Right. And I know we did this last time as well at your screening, but since you do have the type 2 diabetes, it's NHDI policy to go through this diabetic questionnaire form, all right? So, and could I confirm your date of birth? Yep. November 24th, 1965. All right. Did you take your anti-diabetic medication today, your metformin? Yes, excellent. What time was that? Was that noon? All right, great. How often does your physician recommend that you test your blood sugar? Every 3 months you see your doctor to get your A1C? Okay, awesome. And let's see, it looks like the last A1C we have on record here is from September, so that was 7.1. Is that your normal? Yeah, that's your normal. Okay. And did you have something to eat today? Yeah, you did. You had lunch. You had a turkey sandwich. Excellent. Do you feel that your blood sugar is low now? No? Okay. When you do feel like your blood sugar is low, what are some symptoms that you have? Dizziness, lightheaded? Okay. All right. And do you have a sugar source with you? Any food or glucose tablets with you? Oh, great. You brought us Snickers. Healthy choice. I love it. All right. If you could just sign here. Okay. Thank you. All right. And now I will take your blood pressure real quick. Put this on you. Alright. You guys should know this part. Okay, 130/85. Excellent. That's better than last time. So, one thing I will discuss with you is the new research on our recommendations for lead aprons. I have an informative worksheet for you to review real quick. I have to plug a few things in the computer, so if you want to just look that over and we can talk about it in just a minute. I'll be right with you, okay? Alright. So now I'm going to put in the patient's blood pressure, pulse, and respiration rate. Okay. Now, I'm going to sign the update form. And if you don't mind signing the update form for me as well, right here. All right, thank you. Hey, Miss Leo Flag, I'm ready for a check on. Okay. Hi, Mr. Dexter, how are you? I'm Rachel Leo Flag, one of the instructors. I'm just going to check a few things. All right, so you have your medication. Nothing, no changes in this medication. No changes there. Okay, and then you have, okay, good. And the diabetic worksheet, great. So Mr. Dexter, you did have something to eat before you came in today? Great, okay. I'll pursue on to my, I'll don my PPE and pursue on to my intraoral exam.
Okay, all right, let me know when you're ready.
Mr. Dexter, before we get started with the intraoral exam, I'll discuss our lead apron policy. So, the American Dental Association, along with the American College of Radiology, has reviewed decades of research and concluded to discontinue the use of lead apron. And in some instances, the lead aprons can have negative consequences, such as trap that radiation underneath the lead apron, and it can sometimes interfere with imaging, making us repeat x-rays unnecessarily. In addition, the dose of radiation delivered by modern machines is also much smaller than it used to be, so due to digital technology and safety features built into the machines. And the radiation exposure is much more minimal and does not pose a risk to the patient, thus eliminating the need for the lead aprons. So we, at NHGI, we are giving the patients the choice on whether they would like a lead apron or not. What do you feel most comfortable with, Mr. Dexter? I understand you can't teach an old dog new habits, so I just wanted to fully inform you, and I understand what makes you comfortable. I'm just gonna drape this over your knees real quick until we're ready to expose, and then we'll put it on once we're ready to expose, okay? So first we're gonna start, I'm gonna feel around for any lumps, bumps, abnormalities. And open. Oh, some TMJ clicking. Do you grind your teeth? You do? Yeah. All right. Bite down together. Stick your tongue out. Oh, some extra bone on the bottom of your mouth. Okay. Stick your tongue out. Say ah. All right. Great. All right. I'm just gonna write a few notes in, and my instructor will come right on over. Okay. I'm ready for my intra-extra oral check.
All right, very good. Okay, get my hands ready, and I'll be right back.
Okay. Lovely day we're having here, huh? How about them Red Sox?
All right, let's see. All right, just lift your chin up for me.
So I felt some bilateral TMJ
Okay,
clicking.
open and close. Great, yes, okay. Oh,
Oh, it's rated.
Okay, all right. All right, open please.
And then there is some bilateral tori on the floor of the mouth.
Okay. Right, stick your tongue out for me, please. All right, very good.
Otherwise, everything was within normal limits, Jenny.
Okay, and I want to check your pink sheet, make sure. So Mr. Dexter, you have an appointment on December 2nd? Okay, well, we'll make sure those x-rays get to your dentist on time. And everything looks good. All right, you are all set to proceed. Just don't forget to check after your next check-in.
Okay.
Okay?
Yep. All right. I will set up for my anteriors. And I will bring up my x-ray matrix so it's ready to go. And I put my anterior exposure settings on. Alright, and I'm ready for my first check-in to expose. That I'm ready to expose.
Okay. You're all set? Okay. All right.
Okay, I'm ready to start.
Yep.
Okay.
Put the time on your sheet. You have your process form. Okay.
Okay.
Right, so your time is 5:20.
5:20. Okay. Alright. Take all the anteriors. I complete my anteriors. And now I can, before I expose the posterior, I can set up my posterior and switch to my posterior settings. interior settings. But before I expose my posteriors, I will get my next check-in.
Okay, and you did your interiors.
Yep.
Great. Awesome. Okay, you're all set.
All right. Thank you. All right. I expose my posteriors. Okay. I expose my bite wings. This Dexter is recommended vertical bite wings. All right. Vertical bite wings, I complete. All right, and then I get my check-in for my end time.
All right. And your end time is 6 o'clock. All right, great. Thank you.
Yeah. Now, I'm gonna take a look and at all of my images. And it looks like I took a pretty crummy canine shot. So on my pink slip, I am going to circle the canine circle here because I need to retake that. Okay. And that's all I think I need to retake. Once I evaluate that, I'm gonna go switch over from Dexis to Dentrix and type up the rest of my clinical note. So I'm gonna write everything on my clinical note. The only thing I'm gonna leave blank is the number of images that we take. So everything except that last number. And then I'm gonna go back to Dentrix and I'm gonna put in the service code Q10, which is a no charge FMX because our practical patients are not getting charged for these x-rays. Okay, so I put that code in. I click complete. Okay, and I'm ready for my check-in.
All right. So you looked at your images and you determined what retakes you needed. Let's take a look. Right. Canine. Yep. Good. And just one more. I would take this one over again because you missed some of the apices up
Oh,
there.
okay.
So I would do that one too. So it's
Okay,
just
so those two.
those two. All right, so let me glove up.
And we
get
will take
ready.
that together.
Yes, be right. And so, yeah. we will.
Alright, so I'll take the canine image first.
All right, so we're gonna click on it and hit repeat.
Okay.
And let's just set them up just a little bit here.
Oh, okay.
All right, and let's just have Mr. Dexter, I'm just gonna move your head forward just a little bit. This will help you when you take your image, okay?
Oh, wow, that is helpful. That really gets his chin parallel with the floor. I didn't even
Yes.
think about doing that. Alright, so what do you think about like this, please?
That's good. Just move it a little bit and more like that. There we go.
Okay. Alright, and body
All right.
down. Alright, hold. Beep. Alright. Great. And those were our retakes.
Yep. Very good. So now what I'm gonna do is, hold on for a second, I'm gonna look at your paperwork and your Dentrix notes to make sure, and your services. And we're gonna put on your pink form how many that we took. So we took 19 plus 2. I'm gonna sign it. And we're gonna go to your Dentrix notes to make sure it's all done. Yes, and then I'm gonna sign the notes. And let's make sure your services are completed. And your services are completed. Very good. So now you can dismiss your patient.
Okay.
All right, bye, Mr. Dexter. Thank you so much for coming in today.
All right. And just a moment while I doff my PPE, I will walk you on out. The torture is over. Great job, Mr. Dexter. And I'm using a barrier to remove my gown. And the gown will be hung up on these coat hangers out here. All right, Mr. Dexter, you can follow me.